How to identify your eczema rash. Are you wondering how to identify your eczema rash? Eczema, which is also known as atopic dermatitis, is a common skin condition that causes inflammation. This often leads to an itchy rash that can look different based on age, skin tone, and where it appears on the body. Let's break down the key signs to help you recognize it. First and foremost, itching is usually the first symptom you will notice. It can be intense, and scratching may worsen the rash or cause damage to the skin. So, if you find yourself itching a lot, pay attention. Next, take a look at the appearance of the rash. On lighter skin tones, it may show up as red, pink, or purple patches. If you have darker skin, you might see brown, gray, or purple patches. The rash can be dry, scaly, cracked, or even thickened. In some cases, the skin might blister, ooze, or crust over, which can be concerning. Now let's talk about common locations for eczema rashes. In infants and young children, you will often see it on the cheeks, outside the elbows, and on the knees. For older children and adults, it typically appears on the hands, feet, arms, and the backs of the knees. Another thing to look for is changes in skin texture. The affected areas may become rough, leathery, or thickened due to ongoing scratching and inflammation. This change can be a clear indicator of eczema. You should also be aware of color changes. After healing, the skin may look lighter or darker than the surrounding areas. This is especially noticeable in darker skin tones. Additionally, eczema can lead to other symptoms. The skin may crack, bleed, or feel raw and sensitive due to scratching. Sometimes, you might notice swelling or warmth in the affected areas, which can be a sign of irritation. Remember, eczema symptoms can vary widely from person to person. It is important to consider your skin tone and age when identifying the rash. The color and pattern of eczema on darker skin may look different from that on lighter skin. If you notice persistent itching along with a rash that matches these characteristics, especially in common locations, it is likely eczema. However, if the rash becomes painful, shows signs of infection, or disrupts your sleep and daily activities, it is best to consult a healthcare provider for a proper diagnosis and treatment. Identifying your eczema rash involves recognizing an itchy, inflamed area of skin that is dry and scaly, with possible color or texture changes. Knowing these features can help you distinguish eczema from other skin conditions and seek the right care.